Hello, I'm Tony Preckwinkle, President of the Cook County Board of Commissioners. I'm joined today by Dr. Priscilla Auguston Ware, Cook County Health's Chair of Correctional Health and Medical Director for CIRMAC Health Services, which provides care for patients at the Cook County Jail, that's our adults, and the Juvenile Temporary Detention Center. We're also joined by Dr. Juleigh Nowinski Konchak, attending physician with Cook County Health's Center for Health Equity and Innovation and physician advisor for the health system's Substance Use Disorder Program. We will be talking about Cook County Health's unique programs and services to support individuals with substance use disorders. May is Mental Health Awareness Month, and as we close out the month, it's important to recognize the connections between physical health, mental health, and substance use. Welcome, doctors. Dr. Nowinski Konchak, how do these patients present when you see them, and what are the connections that you see?
Thank you for having us, President Preckwinkle. When we think about health at Cook County Health, we think comprehensively. We think about physical, mental, and social health, and really the intersection and relationship between them. So a patient might present with trouble sleeping at night, and really the root there is anxiety, and we need to help address the anxiety. Someone might present with low energy, and that could be depression or substance use manifesting itself. So we are proud that our providers and our care teams think about what they're seeing and what might be going on and address physical, mental, and social health together.
So it's a challenge of how to interpret the symptoms that people express and what might be the underlying conditions.
And often there's several things going on, right? There's physical ailments as well as mental health challenges, as well as social health challenges, social isolation, for example, and working within our walls and then with our community partners to help patients be their healthiest self by really thinking about these three buckets as overlapping, and we can't laser in on just physical health or we're going to miss the boat and not help our patients elevate their health.
Needless to say, Dr. Ware, there are connections between people's behavioral health challenges and their involvement in our criminal justice system. And you are involved both at CIRMAC, at the hospital at 26th and California, and the Juvenile Temporary Detention Center. Can you share your experiences there?
Thank you, Madam President. Cook County Health provides a comprehensive medical, mental health, patient care services, pharmacological services, and mental health services for our patients in CIRMAC, which is primarily the provider of health care for patients incarcerated at Cook County Jail. It's the correctional health arm for Cook County Health, and also at JTDC. We are able to, we've approached this in a very multifaceted approach with a comprehensive care where we have providers available on hand when patients walk into intake. There is about 42% of patients in the Cook County Jail who are on the mental health caseload. So we do really pay attention to that. Our staffing matrix is robust, has psychiatrists, mental health staff. We have people who are advanced care providers who are also engaged in the care of patients in the Cook County Jail. We screen every patient who comes into the jail to assess their needs for mental health, to assess their needs to continue any medications that they've been on in the community. And we're also able to initiate medications if those patients come into the compound, because we have a psychiatrist or an advanced practice provider on staff in the intake process to be able to do so in the first 24 hours. We take pride in our intake process, and our CIRMAC building actually holds some of the very severely mentally ill patients on the compound, and we provide services including risk assessments for suicide. We provide group therapy, individual therapy, and these programs have really been put in place to really take care of the needs of the people on the compound. The live-in units out on the compound also do have all these services available for them, but in a less acute setting.
All right, I didn't get much past one of the initial things you said, which is 42% of the people who come into detention have a behavioral health challenge.
That is correct, Madam President. 42% of the people who enter Cook County Jail are on our mental health caseload, which actually positions Cook County Health CIRMAC as one of the highest mental health providers in the state.
A lot of the challenges we face in our criminal justice system are the result perhaps of the fact that we are unable to meet the needs of people with behavioral health challenges.
That is correct. And we at CIRMAC are very aware of that. And whenever a patient comes in, it is very important to us to really assess what their needs are, to assess what their medication management is. With the help of our on-site pharmacy and the help of our patient care support services on site, we're able to really come together and take a holistic approach to taking care of our mental health patients on the compound.
You know, for a very long time, our health and hospital system addressed physical health challenges that people might face. We didn't have the same footprint in behavioral health. And in the last several years, we've invested a lot in building up our behavioral health division within Cook County Health, and also in grants to community-based organizations that provide behavioral health services. Needless to say, that's long overdue.
Mm-hmm. Yes, so that's right. You know, Cook County Health is not in this alone. It is key that we work regionally with partners, key partners in the ground in the community that are providing services, and then also within our own walls. That's right, there's been a big effort to increase the availability of mental health and substance use services. So I'll give you a couple examples. So we have what's called the Bridge Clinic. This is for substance use disorder, largely opiate use disorder as well as alcohol. This is a clinic that lives physically at the core center near Sturger campus, but is also virtual, and it's available as an easy button for patients, whether they're engaging for the first time or re-engaging after spending time with Dr. Ware and her team
To the criminal justice system.
Exactly, to re-engage in services that often include things we offer in-house: primary care, medications for addiction treatment, recovery coach services, as well as work with our partners. So people can enter the Bridge Clinic by walking in. They can call 312-864 for MAT. There's also information available on the website, and it's low threshold. We welcome people back if it's the 10th time we're seeing you, if it's the first time we're meeting you, and we're able to help you address your physical, mental, and social health needs through programs, such as the embedded social workers that exist at all of the ambulatory centers, through programs that address housing, like the medical respite program that Cook County Health has, as well as the low threshold harm reduction housing. Another example I'll give you, Madam President, at Providence Hospital, the Clinical Triage and Stabilization Center opened, and this is you can think of it as an extension of the ED. It's a warm welcome when you're in mental health crises to go and present and be able to have a bit of a longer stay and get wraparound services in that acute moment of crisis, and then a plan for when you're out in the community, a warm, not just a warm handoff, a warm hug out to the Cook County Health and partners to give you your best shot at addressing your mental health needs.
You talked about MAT, that's medically assisted treatment?
Right, so medications for addiction treatment. So we have 3 FDA-approved products for opiate use disorder and alcohol use disorder. And Cook County Health has worked diligently over the last decade to create access. So whether you're walking into the new Bronzeville Health Center, or you enter through intake at CIRMAC, or you are hospitalized at Stroger inpatient, you're going to be assessed by a team, a multidisciplinary team. So a provider who's going to offer medications, show you the menu, talk to you about the role of medications, address some of the stigma that exists behind these medications. In many of our settings, we also have peers in recovery themselves who have walked the walk and can meet you where you are and talk about the barriers and what you want to engage in, and then work through that plan with you. So medication for addiction treatment plus psychosocial supports that the patient is interested in.
So Dr. Nowinski Konchak has talked about outpatient treatment, okay, but we provide substance abuse treatment for people who are detained at the jail. So what does that involve?
Thank you, Madam President. Yes, we do. We are the only accredited and licensed OTP program, which is the opiate treatment program, in a correctional setting in the state of Illinois. We've been continuously accredited since 2009, We provide all the three FDA approved medications for opioid use disorder in the jail, as well as an oral and an extended release naltrexone, which Dr. Nowinski Konchak talked about, which is used for alcohol use disorder. When patients do come into the compound, we also have a medically supervised detox unit where patients are able to safely detox if they really want to detox. As well as when patients come into the compound, if they do come in on methadone, on buprenorphine, whatever they came in with, we're able to continue it as they were in the community by verification. And then also we're able to initiate patients who are interested in being part of the OTP program. Most recently, we expanded our services to these long-acting injectables, which has been shown to be a great option in correctional health settings because it helps reduce diversion. Because when we talk about diversion, we talk about patients who actually want to trade their medications for certain things on the compound.
Okay.
And for that reason, these long-acting injectables are a great option because most of them, nothing to trade. And it's also been really shown to increase adherence and then also to support long-term success rates. So we're really excited about that. And every patient is given that opportunity to have that menu that Dr. Nowinski Konchak talked about. Our OTP program, it's really made robust with our care coordination team. They work diligently and do an amazing job to really warm handoff patients into the community, to a methadone program, to provide patients with a 2 weeks medication, to bridge them to be connected to a community provider who's able to prescribe buprenorphine for them. So this really ensures that we're stabilizing our patients when they come into the compound to prevent relapse and also prevent potentially a fatal overdose. And in my opinion, also helps reduce recidivism.
I understand there's been some work on people declining treatment. And can you share with us some of the reasons why people might not wish to pursue the course you recommend?
Sure. Yeah, we did do a study looking at our patient data, and we had the opportunity to ask patients. And I'll just give a couple examples. A patient indicated they're the caregiver for their grandchild, so they couldn't go to residential treatment. Another indicated their job didn't offer paid time off. If they engaged in the treatment that was recommended, they would lose their job and take steps backwards. So we learned at Cook County Health that we need to offer patients a menu of services and meet them where they are and offer them medication and peer support that's not tied to these other any requirements for engagement. And patients can access and help them access care easily. So for example, you can call 312-864-0200 to get a primary care appointment. Enter through primary care and you can access substance use and mental health services. Enter through our Bridge Clinic, 312-864 for MAT, and also just walk in at the Core Center. Provident Hospital's Clinical Triage and Stabilization Center is another walk-in option on the south side of the city. Just walk in, enter care. We'll be so happy to see you.
And also NAMI is another
and
resource. NAMI is the National Alliance on Mental Illness. This is a great helpline that Cook County Health is helping fund to really connect people to care, to connect people to mental health, for them to be able to get care. And you can also text or call for a loved one or for yourself. And the phone number to be able to connect with people on this NAMI helpline is 833-NAMI-CHI. And that's 833-626-4244.
And there's also a United Way helpline for all kinds of services, right?
That's
I think
correct.
it's 211, and you can get referred to all kinds of employment or housing or behavioral health services.
That's correct.
Dr. Nowinski Konchak, what do you want people to know about accessing care?
What I want people to know is that there's no shame in having a mental health condition. We need to break down this world of stigma. And, if you're suffering from depression, if you're suffering from anxiety, if you aren't sure what's going on, but you feel that something's off, tell your provider. Your provider, will be able to assist you or to link you. Just like you would talk to your primary care provider or the ED physician if you had a headache or felt chest pain, say what's going on, say how you're feeling, bring it up with bring it up with your family. Let your family know what's going on. Get care, seek help that works for you, that is meaningful for you. Treatment is real, treatment's available, and there's a healthier future.
Yeah, if you had a heart attack or you're feeling chest pains or, you wouldn't hesitate to go to a doctor. But if you're feeling depressed or anxious, you might be more hesitant.
That's right. And we need to really work as a community and work with partners and patients and everyone to combat that, because there is a future where the hesitation is gone, hopefully. And that's right. You're feeling overly anxious. You're drinking more than you usually do, and you see it interfering with your home life. Bring that up. Talk to care providers. And seek help, because help is available. Help is here.
We at Cook County Health, CIRMAC, we are available. We believe in our Cook County Health mission to take care of people regardless of where they are from, who they are, with no judgment whatsoever. We have a team of physicians and staff available to everybody who is experiencing any kind of mental health issues or any kind of substance use disorders. We have addiction medicine specialized physicians on staff who are available and ready to really meet the patient where they are and to really put our arms around them. There is help. We are there to help, and we just want people to come to us and have a conversation for us to be able to provide the help.
Thank you. Thank you both.
Thank you.
Thank you.